Mobility exemplars, multiple sclerosis, and Parkinson's disease. Concept definition: mobility. Purposeful physical movement that is dependent on the synchronized efforts of the musculoskeletal and nervous system, as well as adequate oxygenation, perfusion, and cognition. Mobility requires adequate energy, adequate muscle strength, underlying skeletal stability, joint function, and neuromuscular coordination. Components of mobility: skeletal system, muscular system, nervous system. The skeletal and muscular systems cannot produce purposeful movement without a functioning nervous system. Definitions to know: immobility, incapable of being moved, not moving. Flaccidity, decreased muscle tone, pick up someone and it just falls right back to the bed. Spinal cord injury when you're a paraplegic, and tetraplegia, also called quadriplegia, and spinal shock. Spasticity, increased muscle tone, not that smooth moving, baclofen. Paresis, impaired muscle strength or weakness. Paralysis, absence of strength secondary to nervous impairment. Paresthesia, an abnormal sensation of tingling or numbness or burning, describe neuropathy. Bradykinesia, abnormally slow voluntary movements in speech, Parkinson's disease. Dyskinesia, impaired ability to execute voluntary movements. Scope of the concept: complete immobility, partial immobility, complete mobility. Mobility and immobility may refer to a particular part of the body, or they can refer to the entire body. Prolonged bed rest, which nursing interventions will be in place to prevent complications. Effects of immobility: lack of exercise, inactivity, or immobility related to illness or injury place a person at high risk for serious health problems. Can affect the major body systems and has been linked to a predisposition to many chronic health problems. Loss of strength: 10-20% decrease in muscle strength per week can happen with someone who's bed-bound, so it happens really fast. Loss of muscle mass: 3% loss within thigh muscles in 7 days, greatest loss in back and weight-bearing muscles. Inability to exercise, inability to carry out your regular adults powered. These people going to get to work? How are they going to drive? We can make them as independent as possible, and the effect that it's having on them psychologically and socially. Cardiovascular system. Effects of immobility: increased cardiac workload, increased risk for orthostatic hypotension, increased risk for venous thrombosis. Respiratory system. Effects of immobility: decreased depth of respiration, decreased rate of respiration, pooling of secretions, impaired gas exchange, gastrointestinal system. Effects of immobility: disturbance in appetite, altered protein metabolism, altered digestion and utilization of nutrients, decreased peristalsis. Urinary system. Effects of immobility: increased urinary stasis, increased risk for renal calculi, decreased bladder muscle tone, musculoskeletal system. Effects of immobility: decreased muscle size, tone, and strength, decreased joint mobility, flexibility, bone demineralization, decreased endurance, stability, increased risk for contracture formation. Metabolic system. Effects of immobility: increased risk for electrolyte imbalance, altered exchange of nutrients and gases. Integument. Effects of immobility: increased risk for skin breakdown and formation of pressure ulcers. Psychological well-being. Effects of immobility: increased sense of powerlessness, decreased self-concept, decreased social interaction, decreased sensory stimulation, altered sleep-wake pattern, increased risk for depression, risk for learned helplessness. Risk factors for impaired mobility. Non-modifiable. The aging process. Genetic factors. Muscular dystrophy. Marfan syndrome. Amyotrophic lateral sclerosis. Rheumatoid arthritis.
Systemic lupus erythematosus. Gender.
Modifiable. Obesity asterisk. Exposure to certain viruses.
Epstein-Barr. Osteopenia. Osteoporosis. Osteoarthritis.
Chronic pain. Trauma. Pregnancy in maternal nutrition during pregnancy. Assessment. History. Past health history, medications, surgery treatments, lifestyle habits. Presence of pain with movement. Recent changes in mobility or problems with balance. Presence of fatigue, recent falls, recent changes in ability to complete ADLs. Musculoskeletal and neurological assessment. Gait and body posture, size, symmetry, and strength of muscles, 0-5 scale. ROM of joints, LOC, pupil assessment, cerebral function. Neurovascular assessment. 5 Ps, see next slide. Diagnostic tests. Bone density test, X-rays, CT scan, MRI, lumbar puncture, blood work, DIT scan, Parkinson disease. Neurovascular assessment. 5 Ps. Pain. Utilize pain scales. Determine location, quality, etiology. So what causes the pain on a scale of 1 to 10? What is it? Is it a sharp pain? Is it a dull pain? Pulses. Compare distal pulses between injured affected extremity and unaffected extremity. Compartment syndrome. Arterial compromise. Pallor. Skin color of affected extremity, and general skin assessment. Pallor is one to more pale than the other is one more swollen and red. General pallor, hemorrhaging. Localized pallor, decreased arterial supply. Paresthesia, changes in sensation, burning, tingling, numbness. Paralysis paresis, indications of nerve or tendon damage.